And this is Andrea Carter, Communications Director for the Center for Closing the Health Gap, and welcome to Health Gap Chat. And I'm joined today with Eric Washington with the Cincinnati Health Department and the Men's Health Department Division.
Men's Health.
And Ali-Rashid Abdullah, who is with the Avondale Walk. And we're going to have a conversation today about the Black Men's Health Town Hall and the Avondale Walk that's coming up. First, let's talk about the Avondale Walk and what is happening and when is it?
It's going to be October the 6th. We're inviting all of the men, women, and children in the Avondale area, 5,000 people, as well as the city of Cincinnati to come out and walk with us.
Okay, and what time is it going to get started?
It starts at 9 o'clock at the Lincoln statue on the corner of Reading Road and Forest Avenue.
And is there any pre-event happening?
There will be health screening prior to that. Something that most black men need to pay attention to and participate in. We're very hesitant to go and get our health checked out until they have to carry us out. So this is really a good event for young and older black men to come out and get checked out free.
So, and everything involved on that day, on Saturday, October 6th, is free?
Everything is free.
Okay, so and where should they go to sign up for the walk?
Avondale on the at the statue at that particular spot there.
Is there an online source that they can sign up for the walk?
Yes, there is. Let's see. They can go to growavondale.org.
Okay, and can you hold that up so we can see the other way around? Okay, if you see this banner out there, this is for the Avondale Walk. If you happen to see it, go to growavondale.org and they have a site for the walk. And or if you want to volunteer on that day, you can also sign up as well there. Let's talk about men's health for a minute. Why don't men talk about health?
I think it's a number of reasons. There's a fear of what we may find out. That's always there. Then there's the fear of needles. Believe it or not, a lot of these big muscle-bound guys are really very frightened of needles. And then there's this tradition of, using different old house remedies to cure ills that just haven't worked for us. We have one of the highest rate of prostate cancer, lung cancer. So it's just time. It's time for us to begin to go and try to begin a process, begin a tradition of going early and regularly to get checked out.
Let me ask you this. Growing up, for both of you, have you ever had the discussion about taking care of yourselves from your parents or from anyone in the community? Have you ever had the discussion at all about going to the doctor and finding out things?
Personally, for me, my mom was a phlebotomist and she worked in public health, so she always knew the importance of going in and teaching us about health, whether it's oral health, whether it's personal health, just physical. So for all my life, I have been participating in my health, make sure I'm healthy and make sure my everything is in proper order. So I had an advantage. Because my mom was in the field. So.
But I mean, for your friends who don't have that advantage, did they ever bring it up, or did they ever say anything, or is it just a taboo subject that you just don't discuss?
It's interesting that we have this conversation because a lot of men, like we discussed before, do not go to the doctor until something happens, until someone has to care. I mean, usually men's health starts to change a lot of times in the late 30s, early 30s to late 30s, or they have some history of prostate. And so a lot of times my friends, they did not go to the doctor. We did not talk about the doctor. We did not discuss the doctor. There may have been times when I came out and said, hey, I'm going to go to the doctor, now give me a shot. And they ask me questions, was it scary? But other than that, overall, we just do not go to the doctor, so.
And I think you had to recognize it had a lot to do with the finances. I come from a family, I had 5 sisters, 2 brothers, mother and father. Father worked as a janitor here in Avondale, actually. Didn't have the finances, didn't have the money to go every time someone got sick, and that became just a point. It was traditional, you wait till you just had to go before you spend that money.
Absolutely.
A choice of food on the table, clothes, to go to school, health care.
But I mean, to take care of your health means that you can go to work. That means you can have a roof over your head.
But that's how people think today. We didn't think that way back then.
Okay, I know my father personally, he's
Yeah.
always asking me, okay, do you have a bottle of whiskey or bourbon? Because you take a little teaspoon of that with a little lemon or a little sugar, that cures everything.
They got a name for that.
They got a name for that, or the drink, taking the castor oil,
Yes.
or the vinegar, or
Home remedies.
home remedies.
Yep.
I mean, they are big in our
Yeah.
community.
Right.
But I'm just saying, at the same time, the women go to the doctor all the time. They take care of the children. That was important. You would think that as the parents taking care of the children, they would see the importance of also taking care of themselves. Yes, I understand about the finances, but it goes hand in hand. That it's just difficult. So
And also, you think about the resources. Were there resources for men back then?
true.
If you think about resources, most of the resources are for women and children. So now, there's no excuse today. We have resources for every possible medical condition you can think of. And there's just no excuse. And again, it goes back to how we're going to educate and make men aware that they are important. They're an important part of a household. They're an important part of their communities, and that we need them to be helpful into this.
Do you think that the men's town hall that's going to happen on Thursday, October 4th, is going to help jumpstart that conversation about how in this contemporary era we need to change the thinking about men and about health as well?
I do. I've been in men's health for about 5 years now. For the first part of the 2.5 years, I worked in reproductive health. And for the last 2 years, I've been focusing on men's health. And we really have not had an opportunity to jumpstart this movement. We have a lot of movements. This should be a men's movement to get men more healthier, more productive, more just need to get more men to.
I mean, it's kind of like a continuation of the Million Man March, which jumpstarted whole many things about men and being empowering of men in many, many different ways. But I mean, if you think about it now, before we didn't think of men as caregivers.
Yes.
Now we see Tide commercials where they're doing the laundry,
Yes.
where the men are taking care of the babies, where they're stay-at-home dads, where it wasn't acceptable before. So this is an evolution of that thinking of what's acceptable in society, but it's a harder acceptance in the Black community,
Yes.
only because of why.
Black, we don't talk about what's happening to us. The tradition has always been, I gotta go to work Monday morning. Like you said, I'll take a drink, I'll take some castor oil, I'll go to bed early, I'll rest up, because I gotta go to work, we have to eat. Men don't talk to each other like women talk to each other.
Absolutely.
Men don't talk about what's happening with their bodies, like women talk about what's happening with their bodies. Men keep a lot of secrets until it's no longer a secret, until they are carried to the hospital, to the doctor. So the conversation is a very important piece, because what the conversation does, it challenges the old traditions of not speaking about what's happening to us.
Okay. So, I mean, but how do we change that tradition? I mean, the young people today.
Conversation.
There's a conversation.
Challenging what was in the past, and looking at the numbers, look what's happening to us. I come from a family, both my mother and father died. They had high blood pressure that resulted in heart attacks. I have one sister that died from a heart attack. I have 3 sisters now who are suffering from high blood pressure, 2 brothers that are suffering from high blood pressure. All is a consequence, all could have been prevented had we been aware and mindful to begin at an earlier age to get checkups, regular checkups. Primarily, this is a consequence of how we have been eating, what we eat,
Right.
how often we eat. Right now, I was just telling him I Snickers, potato chips.
Yes.
I've been fortunate thus far. But this program makes me mindful of how I need to take care of myself.
Absolutely.
Because, I mean, we all love soul food. We all love those wonderful dishes, macaroni and cheese, pig feet.
They're killing us.
But I mean, it's not good for us. But then again, traditionally, when we were eating that, we were also working harder and longer and we were burning the energy, all those calories up as we were eating that way back when. But now everything has changed.
Yes.
I mean, even today, you don't see our kids out in public anymore playing. I mean, it's very rare. I mean, it's hard to get kids to go out for baseball, basketball, football. I mean, you don't see kids playing on the sidewalk or riding a bicycle too much. It just depends on where you live. Is the change good or is the change bad? Or, I mean, where do we go?
We
in this
died at
modern
an
era?
early age from soul food. Soul food has been killing us.
Well, I mean, the tagline for the town hall is more people are killed by the end of a fork than a gun.
Absolutely.
And I mean, which is a very frightening thing to think of. But, you know, people don't think about what they're putting in their bodies because we can go get pork rinds, potato chips, my personal favorite, scoops with French onion dip. I mean,
Mine too.
I mean, there's so much
Yeah, sure,
carbs
yeah,
out there that we
yes.
all enjoy. Fatty, salty, sweet,
Sure,
what have you,
yes.
that we all enjoy. Soda alone is liquid sugar,
Yes.
is just horrible. To especially because diabetes runs in the black community, is just prevalent in the black community as well. How do we change that? How do we change that conversation?
Again, it goes back to a good question. I mean, I think this is a kickstart to what we're trying to do.
Okay.
I'm an educator, and I believe in educating and making people aware. It's time to wake up.
Well,
It's time to wake up at what we're eating, how we're treating ourselves, how we're treating our body, and start focusing a little more on personal growth as individuals.
And that education is the key.
Yeah.
The more that we know better, the more we do better. That is the reality.
well, I thank you for joining us today.
Thank you.
So remember, the Black Men's Health Town Hall is going to happen Thursday, October 4th. At South Avondale School from 6 to 8 p.m. And then the Avondale Fleet Industry Walk is going to occur on Saturday, October 6th. The health screenings begin at 7 a.m. The walk will begin at 9 a.m. Everything is free. And for more information, check out growavondale.org or closethehealthgap.org. Thank you very much, and I'm Andrea Carter.